Hi, my name is Dr. Zerah Ali. I'm a podiatrist at SOS and I work on the foot and ankle team. My podiatry history started back in Canada. There was a program called chiropody, which was the old term for podiatry. There was an accelerated program branch that I was able to take advantage of and transfer over to Temple University School of Podiatric Medicine. And at that point, when I graduated, I did my residency training at Staten Island University Hospital, which is down in Staten Island. And from that point, I've been practicing ever since. So I treat all types of conditions with bone, skin, and tendon, from geriatrics, pediatrics, and everything in between. And that's what I typically treat. My surgical practice would be more forefoot, midfoot surgeries, and rear foot, minimal stuff, usually Achilles tendon injuries or so, but that's what I tend to focus on. Biomechanics, I really enjoy doing that, and treating diabetics, diabetic foot care, and prevention. One of the things about the career that I really liked was that somebody could come in and with pain and then they leave without pain. And that's kind of like an instant kind of gratification that you're doing a good job. So that's one of the things that got me into podiatry, and I think it was a very good field and very diverse. Everybody has a story, and it's important to listen to that story so then you can cater your treatment plan to them. That's my approach. I try to figure out all the status and all the factors that may hinder or help their treatment plans, and that's why I usually will use that approach with my patients, and I'm very down to earth with them because I think it's important. You know, these are people, you know, and I was fortunate enough to get some education, but I'm willing to share that with them and educate them and empower them. I think it's great that we have a podiatrist on site. I trained with some podiatrists as well in my training in Canada. I think it is a very vital aspect to the foot and ankle because, you know, the basis of building an orthotic or an AFO device to help somebody walk is really beneficial. And having one on site is great because I could always go and bounce ideas off their head. We could work together and come up with the best treatment plan for the patient. Physical therapy is huge with podiatry, especially post-surgically, or any tendon injuries that are not healing in conservative ways. Physical therapy is a great avenue to use. I'm a big advocate for them. When I started out of residency, I did start working in Syracuse. I was very much aware of SOS because of its presence. Always thought that it was a great entity, and everybody that worked there seemed to be extremely happy. And I really always wanted to be a part of a team like that. I like to golf. I like to, I'm getting into this aviation thing. Actually, that was one of the things that I was really passionate about as a young buck. I was really into aviation. In fact, I got my glider pilot license, so that might be something I might want to revisit. You know, I'm up for learning anything. I like trying new things and experiencing new things, so that's my thing, and I love traveling. So my whole thing is to keep these things going, you know, because it'll keep you young.